Hello there, thanks for joining us. This is Michael Chapman here on behalf of Genova Diagnostics, and I'm super excited to be here to talk to you about the clinical utility of our specialty lab testing, including profiles such as the NutrEval and the GI Effects. So let's start with GI testing. Our functional GI testing, we've been looking at the microbiome for years and years. We like to say that we've been studying the microbiome since before it was cool. So let's briefly go over what the GI Effects comprehensive profile looks like. Right on the front page of the GI Effects Comprehensive, we have broken down these core functions. And what we've done is try to, understand what are the main roles of the GI tract. We're thinking about, in general, this DIG concept: digestion, inflammation, and immune response, and then furthermore, the gut microbiome. And what we did was we said that the microbiome is really kind of a large, all-encompassing term. So if we're talking about clinical evaluation, we really want to get information into whether there's an infection, whether there's a dysbiosis, or whether there's a metabolite imbalance, which tells us not only what bugs are there, but what are these bacteria actually doing? What are they making? And that's what the metabolite imbalance tells us. So you can see there's kind of an overall evaluation right here on the front page. And then we get into, underneath that, we have these functional imbalance scores. So for each one of those core categories, such as maldigestion, inflammation, dysbiosis, where you're going to get a numeric score for the patient. And that numeric score is generated by the results of the test. And you can see underneath each score are listed all the biomarkers that went into contributing to that patient score. And so this way you can really get an idea of what are the main highlights. Where am I going to start as far as intervention goes? And then what do I do? If you're a little bit new to the field, then we have some therapeutic support options that you might think about when considering some sort of intervention to help lower the score that you see in the pillar. Certainly not an exhaustive list, but just a place to start. And I think this can also be helpful in explaining to the patient why they might be taking or doing something that you're recommending. You can circle those different interventions and so that they understand why you're actually recommending those things. After the first page of the GI Effects, we have a complete microbiome analysis. And we arrived at this microbiome analysis by looking at this AI-supported data analysis. We've profiled thousands of GI effects, and what we did was we did a cluster analysis to really help us understand the shifts in the commensal bacteria that are associated with different clinical presentations. And in that way, you get to compare your patient's results to thousands of other patient results using the same methodology, the same DNA probes, and the same commensal bacteria. Kind of what did we learn from that? Well, we get some evaluations into three different aspects of the microbiome. We look at abundance, we look at patterns, and then we look at overall balance. With respect to abundance, this is just telling you how much commensal bacteria is there compared to a healthy cohort. So if the patient has overall more commensal bacteria, it might be suggestive of a potential microbiome overgrowth, or maybe just be due to recent supplementation with probiotics, prebiotics, and that sort of support. If you see a shift to the left, the patient has overall less commensal bacteria, which might be indicative of a potential microbiome deficiency, such as after antibiotic use, or maybe a diet low in fiber and prebiotic-rich foods. After looking at abundance, we look at patterns. And we have a couple novel biomarkers that we discovered by looking at the data. We have first the inflammation-associated dysbiosis score, which is an indicator of a dysbiotic pattern that's associated with GI inflammation. So what this is telling us is, of all the commensal bacteria, could we figure out a pattern that related to inflammation in the gut? And that's absolutely what we found and how we generated this inflammation-associated dysbiosis score. Levels over 30 suggest a bacterial pattern that is suggestive of inflammation. Doesn't necessarily mean there's inflammatory biomarkers on hand, but just that the pattern of bacteria is one that is alike in people with inflammation in their gut. And the second one is the methane dysbiosis score, which is an indication of a different type of dysbiotic pattern that's therefore associated with methane production. And so this can tell us a little bit about information around whether that microbiome is likely to be producing methane, which we know is associated with slow transit time, constipation, and some other types of downstream effects. The last section is the commensal balance, and we look at it in two different ways. We have the commensal balance graphic and the relative commensal abundance. The commensal balance graphic is telling us, compared to healthy individuals, overall, what is this person's microbiome looking like? Are they looking like a pattern of bacteria that we see in IBS patients, in mood disorder patients, in metabolic dysfunction patients, or even chronic fatigue patients? They all had a similar unhealthy balance. And so does the patient's microbiome look more like these different clinical disease cohorts or more like a healthy cohort? And then to the right, we have the relative commensal abundance, which is just looking at when you start to group these commensal bacteria according to their phyla, are we seeing abnormalities in the patient's results as compared to a healthy cohort, which gives you another layer around suspicion of dysbiosis. After the microbiome analysis page, we have the biomarker page here, and you can see listed out these biomarkers related to digestion and absorption, such as pancreatic elastase and fecal fat, inflammation and immunology, such as calprotectin and eosinophil protein X, and then finally gastrointestinal microbiome and their metabolites, such as short-chain fatty acid production and beta-glucuronidase, all of which relate to the overall evaluations for maldigestion, inflammation, and metabolite imbalance. After that, we have our commensal bacteria page, 24 commensal bacteria performed by PCR analysis, and this is where we generate a lot of the information to create those two microbiome synthesis pages. Also, individual bacteria certainly do have unique clinical associations, such as bacteria, I think of lactobacillus and bifidobacteria, Methanobrevibacter smithii is an important bacteria on this page, as well as Akkermansia, which we know is getting a lot more attention these days as it relates to overall integrity and function of the mucus layer of the GI tract. Following the DNA analysis, we perform an additional microbiome culture. So we're looking for aerobic bacteria that might grow out under a culture plate. We are unlimited in our ability to pick up any bacteria that might be harboring there. So that additional bacteria section can result in 1 bacteria, 6 bacteria, and all various forms and types. If you see anything listed as a potential pathogen where it shows up in the yellow, we perform botanical and pharmaceutical sensitivities against that specific organism. So in this patient, we would have run botanical sensitivities, pharmaceutical sensitivities against Klebsiella and Candida. Following the culture analysis on the GI Effects Comprehensive, we do the gastrointestinal microbiome parasitology, and we're using 2 different methodologies to make sure we're covering all bases. The first one is a microscopic O&P, which can be either a 1-day O&P or a 3-day O&P, and here we're looking for any and all parasites that might be inhabiting a patient's GI tract. Anything that we find under the microscope, we'll report it on this page. We follow that up on the right with a PCR parasitology, where we're looking at the most common parasites that inhabit or can infect a patient, such as blastocystis and Dientamoeba fragilis, Giardia, and some of the others. And if we do find a blastocystis, we do an automatic reflex subtyping to determine what's the actual likelihood, what's some of the patient populations, demographics, and treatment options that might be specific to that type of blastocystis. So let's take a minute and move on to some of our nutritional profiles. We are the industry leader certainly in micronutrient testing, and let's talk about how we get there. You know, when we're talking about nutritional evaluation, there's lots of different things that you can do, but we have 2 main profiles here at Genova Diagnostics. We have the NutrEval profile and we have the Metabolomics Plus. And the NutrEval profile does require a venipuncture, whereas Metabolomics Plus is an at-home collection. Both of these profiles include organic acids, amino acids, and oxidative stress markers. The NutrEval profile includes a red blood cell fatty acid assessment and nutrient and toxic elements as compared to the Metabolomics, where the blood spot fatty acids and toxic elements are an add-on. Looking at the front page of the NutrEval test, we have the results overview similar to what we saw in the GI effects, where it gives you the different categories of functional imbalances such as oxidative stress, mitochondrial dysfunction, methylation imbalance, followed by these functional imbalance scores and pillars. And again, we have these listed out, and then underneath each score, you see all the biomarkers that contribute to the total evaluation for that function. As you can see here on the Metabolomics Plus, given the fact that the fatty acid portion is actually an add-on, whether you add that on or not is going to determine whether the front page populates with that fifth pillar called omega imbalance. If you don't do the blood spot fatty acid add-on, then you'll simply have these four pillars listed out, as you can see. After the front page of these reports, we have the nutrient need overview, and we're looking at all these nutrient categories, including antioxidants, B vitamins, minerals, essential fatty acids, GI support, vitamin D if you use that as an add-on on the NutrEval, and then finally amino acids at the bottom of the page. It's important to know that not only are we giving a 0 to 10 score for nutrient need of each one of these nutrients, but we also have suggested recommendations that are age and gender specific. So keep that in mind. And then the last column where it says provider recommendations it's an area that the clinician can use to write on any sort of changes, alterations that they'd like to make in their overall recommendations, given the fact that the clinician is certainly going to know the patient case a lot better than we will. We also have, following the overall nutrient need assessments, we have a pathway page of oxidative stress and mitochondrial dysfunction that allows you to visualize what we're really looking at. You know, we're looking at intracellular evaluations of biochemistry, right? And so we're trying to identify, are there any backups in cellular metabolism? And that can ultimately give us information about nutritional needs and nutritional cofactor limitations. So at the top of the page, we're looking at how macronutrients like fats, carbs, protein ultimately are turning into energy at the bottom. And if you really start to see backups in these pathways, or maybe even evidence of oxidative stress or poor antioxidants, then it's very suggestive of an overall problem around oxidative stress and mitochondrial dysfunction. Moving into the analytes that we're actually using and measuring to evaluate for nutritional needs, we start with organic acids. We have the organic acids broken out into main categories such as the malabsorption and dysbiosis markers, the cellular energy and mitochondrial markers that we saw just on that previous page, the vitamin markers, the neurotransmitter metabolites, toxin and detoxification markers, and lastly, oxalate markers. Following that section, we have 4 different biomarkers for oxidative stress, including antioxidants such as glutathione, which is our body's main and most powerful antioxidant for neutralizing free radicals. We have CoQ10, which is an endogenous antioxidant involved in cellular energy production. Then oxidative damage markers like lipid peroxides, which is oxidative damage to cell membranes and fats, and then 8-OHDG or 8-hydroxydeoxyguanosine, which is oxidative damage to DNA, certainly something we do not want to see evidence of. After the oxidative stress markers, we have amino acid evaluation. If you're running the NutrEval, you have an option to measure the amino acids in either the plasma or a first morning void. The amino acids tend to reflect a more steady state of protein intake when you're looking at them in the plasma as compared to when you're looking at them in the urine. And remember that essential amino acids must be obtained through dietary intake, whereas non-essential amino acids can come from the diet or through conversion of essential amino acids, but that does require nutrient cofactors, which can give us some insight into whether there's actually adequate availability of some of these important nutrient cofactors. I think of vitamin B6 and magnesium as a couple that are important here. Following the amino acid page, we have the essential metabolic fatty acids, the EMFAs. On the NutrEval, this is done by a red blood cell analysis, and we have all these listed out here, the omega-3s, the omega-9s, saturated fats, omega-6s, and even things like trans fats listed on this page, including the very important omega-3 index, which is a strong indicator of cardiovascular disease risk when it's low. And that is all the time we have for today. I thank you for joining us. I hope that was informative and taking an overall kind of broad look at the products that we offer here at Genova Diagnostics and some of their clinical utility. And again, I thank you. If you have any questions, you can always contact us at Genova Diagnostics, and we look forward to hearing from you.